have you viewers. Today we have Dr. Seyi Oyeyemi and he'll be here to take us through this journey. Good to have you, doctor. So today we'll be talking on hepatitis. We all know hepatitis has been a public health concern, and as you all know, hepatitis is something that nobody would want to experience. But for those that already have it, how do you take care of yourself and how do you ensure that you don't pass it to somebody else, ensuring your own safety and the safety of others? You don't need to bother yourself much on that because we have an oracle here that will do justice to that. So, doctor, what exactly is hepatitis?
Thank you very much for having me on your program. Well, the way to put it is actually to explain what hepatitis itself means. Hepatitis basically has to do with an inflammation of the liver. So anything that will lead to an inflammation or a swelling, of the liver cells is what we call hepatitis. Hepatitis simply means, in simple layman's terms, an inflammation of the liver, or a swelling, an abnormal swelling of the liver. And there are so many causes of this inflammation, so many. It could be anything, drugs, to infections, to alcohol, viruses, bacteria, parasites, all sorts of things. So we can't even know what has caused them. But basically, it's an inflammation, a swelling of the liver. That's what we refer to as hepatitis.
How does it spread? Because I've heard somebody say, I don't like eating out. If I eat out, I may just contract hepatitis. Does it mean we can also get hepatitis from eating dirty food?
Fantastic question. And so the way to look at it is this. Let's not look at hepatitis B in isolation. Let's look at hepatitis A, B, C. Alright? Now, let's start with A. Like I told you earlier, hepatitis B is the most worrisome because the world over about 300 million people are infected with it and have chronic medical conditions that could actually lead to cirrhosis and eventually to cancer. Now, for hepatitis A, it's actually transmitted through the fecal-oral route, meaning that you can actually get it from what you eat, feces and all of that. So, water that is infected, food that is infected, you could actually get hepatitis A. For hepatitis B and C, they are basically transmitted through blood, body fluids, injections and all of that. So you don't typically get those ones through the fecal-oral, and that's the difference, you understand. And that's the reason why hepatitis B, if you look at hepatitis A, B and C, hepatitis A is a self-limiting infection. In other words, you can get it and you never even know. After a while, it clears itself and you don't even tend to see it. But hepatitis B and C, they are the ones that are usually more chronic in nature, and they could go on to lead to cirrhosis and liver cancer, which could lead to death eventually.
Are there some particular group of people that you say they are more predisposed to getting hepatitis, or it's just a general problem?
Well, if you look at the modes of the transmission and infectivity, since it's transmitted either through fecal-oral, through sexual transmission, a predilection for either gender, either male or female, is not really something you find in place. So anybody could get it, almost an equal position for male and female, anybody could get it, and that's the thing about hepatitis. When we talk about hepatitis D, it's usually hepatitis B that they focus on, though there are other causes, obviously.
Okay, so you are trying to say there are different types of hepatitis?
Of course. And they've been, simply alphabetically labeled so that it's actually easy to identify. Basically, the common ones are A, B, C, D, and E. And then the commonest, the one that has a lot of economical and definitely medical importance, is that of hepatitis B.
So who should be worried about it? Who should be worried about it?
Everyone, healthcare professionals, anybody, an adult, male, female, people who are going to be involved in coitus, sexual intercourse, should be worried. Everybody, even children who are born, should be worried.
So nobody's doing it.
Yes.
So how can one know if they are infected?
Very good question. You see, the thing about hepatitis, I'm assuming we're talking about hepatitis B, which is the commonest.
Yes.
So if we're talking about hepatitis B, the interesting thing about it is that most of the patients that don't have it don't tend to have any symptoms. They don't have any jaundice, they don't have any abdominal pain, nothing at all. Some of them just go for job employment opportunities, they go for tests, and then that's how you find out that they have hepatitis B. They just do a test and they say you have hepatitis B, they're shocked. People have had it since childhood, in their 30, 40 years. No simple symptom, nothing. You don't tend to see anything. And people can live like that all through their life cycle till they get to 80, 90 years and they don't have any symptoms. However, a very small percentage of patients will actually come down with symptoms. And the common symptoms that you tend to see are 1, In the eyes, you can actually look at the eyes. You know, just look at the body downwards and you can actually identify some of these symptoms. Jaundice, which is one of the most prominent, that's the yellowness in the eyes. If you pass urine that will be colored, you see dark colored urine, when you pass urine so darkly colored that you're wondering what this is. Some of them will become anemic, they're pale, they will have fever, they will have abdominal pain, some will have pruritus, or itching all over. All that types of symptoms that are non-specific. You understand? But by and large, the common symptoms that people see and they get worried about is the jaundice. Because looking at somebody's eyes and seeing them yellowish could actually be a source of concern for anybody.
You've talked about the hepatitis A being self-resolving, it can take care of itself with time.
A.
Yes, A. Then B, does it go away on its own?
Yes, that's the question we tend to get from patients. Like I said, the three common ones in this part of the world are A, B, and C. For A, it is self-immunity. If you get it, usually your body clears it. For B and C, they usually do not go away. They become chronic, and that's why you keep checking, the test, you keep seeing hepatitis B surface antigen is positive over the years. The same applies for C. And like I said, the B and C could actually progress into liver cancer and could lead to death, as a matter of fact. The interesting thing also has to do with the vaccination of these three hepatitis viruses. For hepatitis A, there's actually a vaccination against it. For hepatitis B, there is a vaccination, but for hepatitis C, there's no vaccination. And that is why when we talk about preventable cancers that are caused by hepatotrophic viruses or viruses that attack the liver, we talk in terms of hepatitis B, because you can actually get vaccinated and you are prevented. But the moment you get the virus, you can no longer get vaccinated, and that's the problem. And that's why in your awareness, you should actually focus on vaccination schedules and everything. People who have, intervals or times when they go and do this test. If they're negative, they get vaccinated. Once you're vaccinated, you really cannot pick it up again, and that's a big plus for the vaccines.
So the question of a couple, like one has hepatitis B and the other one does not, and you say it's transmitted through sexual contact,
fluids,
okay,
blood.
So how can the other partner stay safe without getting it, even without using condom?
Very good question. You see, that's the thing. We call this what we call discordant couples. It happens in HIV too, human immunodeficiency virus. People who have HIV, the husband has HIV, the wife doesn't, and they sleep together, unprotected sexual intercourse, and yet it's not transmissible. The same thing happens with hepatitis B. Couples who have been married for several years, and one partner has it, the other has never been immunized, yet she doesn't have it. There are a lot of factors that we can't really go into now, right? The way the body works, right? There are some gateways that allow these viruses into the cells. Some people just have protective mechanisms that make them unable to actually pick up these viruses. It's actually going to be an elaborate topic for this our discussion. However, one shouldn't bank on that, right? What to bank on is protection or vaccination, as you were, whichever one is going to be effective. That's what you bank on. You don't bank on the discordant couple theory. That will not be a good way to protect oneself. However, safety. Whatever you can do to protect yourself is very important.
Mother-to-child transmission is possible with hepatitis B and C.
Yes.
So how do we ensure that the child does not get infected in case the mother is a carrier?
Very good question. So you see, I talked about vaccinations, and that's why I said hepatitis B actually has a vaccine. Unfortunately, for hepatitis C, there are a lot of vaccinations still under trial, but they haven't been yet licensed. But for hepatitis B, when a mother has hepatitis B and is about to have a baby, what we do is the moment the child is born, we actually give what we call an immunoglobulin, which is an antibody that protects the child. When we give the antibody, that child cannot pick it up, even though there's a lot of viruses as antigens flowing in the bloodstream. The child doesn't pick it up. And so there are very good treatment mechanisms that ensure that the baby doesn't get it. Immunoglobulin is 98% protected. Once the baby has it, that's it, he doesn't pick it up.
We are still on prevention because that's the most important part of the whole thing. So in terms of preventing it, are there other tips that you can give out to the general public on how to stay safe and free from hepatitis?
What I advise people generally is that when it's time for their birthdays, you go and do a checkup. After eating all the cake and everything, you go for a checkup. If you're negative, you get vaccinated. And the interesting thing is that the vaccines typically last for up to 10 years. And then you probably will need a booster after that. So, once you've had it, you're not worried about the fact that HIV is not protected, or you can't get protected by vaccination. At least you have hepatitis B, which is one of those that, you can get vaccinated and you prevent yourself from picking up this virus. one should afford oneself the opportunity. And it's inexpensive, really, if you look at the cost implication. So, your birthday, do all those tests, the vaccinations that are possible, make sure you have all of them. For people who live a risky life, there's protection, use of condoms, alright? Abstinence is better anyway. But then, for those who cannot use condoms, and then for those, like I said earlier, during your birthdays, the vaccinations that can be had, you make sure you have those vaccinations, and that's if you're protected.
We're rounding up now, so I want to know if somebody has hepatitis, and I'm talking about people that didn't know early enough and now it has progressed. Is there like some glimpse of hope that it's possible for them to be free entirely from it? Or is it like a death sentence? If you have it, it's over for you, there is no cure? Is it like it's treatable? Can one treat it and then you get free from it, like for good? Or is it like even after treatment, it is still be in your body, you can still pass it to somebody else?
So that's another good question, because at the end of the day, some people have picked it up, either from childhood, from their parents, and then, they grow up and suddenly they realize they have hepatitis B. I actually mentioned something, there was a hindsight I actually tried to mention. You see, 90 to 95% of patients with hepatitis B do not need any form of treatment. Let me say that again, because it's actually a very good statement when you talk about hepatitis B. 90 to 95% of patients who have hepatitis B do not need any direct treatment. All they need is regular monitoring of their liver, regular monitoring of the viral load as well, and other parameters that we usually check. And most of them will not need anything till they get to their old age. However, a very small percentage of patients would actually need to be on medications, and they probably need to be on medication for life for a reasonably lengthy period of time. For those patients, if they are not on those drugs, they could actually progress to cirrhosis and then to liver cancer. Liver cancer, it's got no cure. And we'll have only one liver. Once the liver is bad, there's nothing you can do about it. It's either you have a transplant, there's nothing else you can do. The other thing is patients who have hepatitis B must avoid anything that also tends to damage the liver. Because you already have this hepatitis virus that has a very good potential at damaging the liver. People will now start to take a lot of alcohol. People take a lot of local herbs. People take all sorts of drugs that are actually toxic to the liver, will only worsen their chances or reduce their chances of survival. So we usually advise that patients who have hepatitis B should avoid such things, alcohol, herbs, or anything that's going to damage. You can't just take drugs on your own. Many of the drugs we actually prescribe in the hospitals can't just be used carelessly. Usually we take them in combination. And that's why if you have things like that, you let your doctor know so he knows the drugs he can prescribe and those that he cannot prescribe.
It's been a very wonderful one today. So before we go, I would like to throw a question at you. This issue of somebody getting worried over, okay, you kissed a stranger who you later found has hepatitis, and you also shared cutlery and you didn't know. Now you are worried that you might have it. So is it possible to get it through exchange of saliva or stuff like that?
Yes, you are absolutely right. Hepatitis A could actually be transmissible through fecal-oral route, and that means that by extension, if you were to kiss someone with hepatitis A, you could actually pick up hepatitis A.
Oh.
However, yes, hepatitis A is the one that is self-limiting. In other words, most times, even if you pick it up, it clears on its own with just simple medication. But there's also a theoretical risk of picking up even the ones that are transmissible through blood and body fluids. That's hepatitis B and C. For instance, one has an injury and has some bleeding in the oral cavity. If by chance both of them now have something similar, you can actually have blood finding its way between these two partners, and then the patient can still pick up them. But that is a theoretical risk, like I said. It's not something that we tend to see in real life, but then it's a theoretical risk. But hepatitis A could actually be transmissible through kissing and all of that.
Okay, so you're a medical practitioner. What would you say is the general outlook to hepatitis? Do people that you come across, do they give much importance to knowing the status of their hepatitis, if they have it or not? Or do you get to encounter patients when the virus has actually progressed, when the disease has advanced in their body? I believe there is no other means of knowing if you have it or not without going through medical screening. So do people really go for these things, or is it until there is a problem before you see people trying to seek for help?
You see, interestingly, most of the patients we see is usually by happenstance. In other words, people come in for employment tests, or they just come in complaining about something and the doctor just decides. Many people are not aware that it's a test that should be done. They're not even aware that you could get vaccination. They're not even aware of the methods of transmission and all of that. So people don't come to the hospital and say, I want to check that it's rare. Most times it comes with other things. You're trying to get a job, you're trying to get married, or something, and then hepatitis B test is actually included. Otherwise, typically people don't come on their own and say they want to do tests. Wow. So that's the thing, But then, what do you do? I've lost, a close friend with hepatitis B, and sometimes these things are painful and worse, especially since you know that there's treatment. Then what do you do? So, your advocacy and what you're doing is really good because you're able to get people enlightened on how to pick up these diseases and prevent it. It's actually a very long way.
Thank you so much, Dr. Sheyi, for doing this with us. To you viewers out there, as you already know, it's World Hepatitis Day, and this is our own little way of marking this year's World Hepatitis Day. The theme remains Hepatitis Can't Wait. So, with a joint effort of yourself and myself, we can help to eradicate completely this public health menace. Get tested today, and most importantly, get vaccinated. I remain my humble self, Miss Florence. Till next time, whatever you do, go for wellness.